Ontario and the federal government have agreed to a new 10-year healthcare plan that would see the province receive billions of dollars more to improve the healthcare system. Well, this as nurses protested working conditions and pay, and one Liberal MPP introducing a new bill that would keep health agencies in check. Out of the 10-year, $46 billion deal with Ottawa, the province of Ontario set to receive $8.4 billion in new money, plus $776 million in a one-time payment to address, quote, urgent needs, especially in pediatric hospitals and emergency rooms and long wait times for surgeries.
This will just continue to augment the things that we're doing, and it's beneficial because it's going to allow us to continue investing in healthcare, like I said, to make it sustainable, not just for today, but for the future.
However, the leader of the opposition says the Ford government didn't need federal funds to improve the situation in hospitals.
They could do that today because they have $22 billion that they haven't spent. They have $1 billion just in funding that was allocated to healthcare in the last year that they could have spent. They could spend it right now, and they're choosing not to.
Mayor Stiles added that the province could have hired more nurses and paid them better wages, something thousands of nurses are clamoring for in the province-wide protests today.
More support is better staffing, which results in better staff-to-patient ratios, and that's just safer for us. It's safer for the patients. It's better care, better outcomes.
Public system is fantastic, but it's been disabled. It's an engineered problem, and more nurses are disappearing and are going to disappear into a private system because the conditions will be a bit better.
Liberal MPP Dr. Adil Shamji says while not-for-profit private clinics have their place in healthcare, such agencies still need regulations to protect workers and the system. Shamji proposed a private members bill earlier today that would require agencies to obtain a license issued by a registrar in the Ministry of Health that would be valid for 2 years and can be revoked or suspended at any time.
Agencies will not be allowed to assign temporary nurses to work at locations that those nurses are already permanently employed at or have been employed at recently. Agencies will not be able to forbid nurses from working at sites that they were recently assigned to through their agency work.
NDP leader Mayor Stiles says the fact that these agencies exist in the first place is a problem and that they are able to price gouge the healthcare system because the province has been underfunding healthcare and not treating nurses and other healthcare professionals well.